Hello friends, welcome to another episode of Decode ECG series. Assuming that this ECG is taken at normal standardization, let's see the ECG and calculate the rhythm. For that, you have to see lead 2. So let's say lead 2. P waves looking normal. See here, P waves are similar and every P wave is followed by QRS. And RR interval looks fairly regular. So this shows normal sinus rhythm. After knowing the rhythm, we have to calculate the rate. That is by 300 divided by number of big boxes between two R waves. So how to calculate that? So these are R waves, number of R waves, number of big boxes between R waves. 1, 2, 3, 4 and half to 5 boxes. So let's take it as 5 boxes. 300 by 5 means 60. It's around 60 beats per minute. That is a borderline bradycardia. So after that, we have to calculate axis. For that, you have to see lead 1 and lead AVF. So in lead 1, QRS is predominantly upward, and lead AVF it is predominantly downward. So one is going up, one is going down. That means they are leaving each other. See, one is going up, one is going down. They are leaving each other. Leaving each other means left axis deviation. So after that, you have to comment on the waves. So for that, you have to see from P waves. So P wave is best seen on lead 2. Lead 2, they are looking normal and similar, so no abnormality. But see the QRS complexes, especially it's more prominent here in lead 1. What happened here is, see, there is slurred upstroke of the QRS complex. So slurred upstroke, initial part of the QRS complex is slurred. So they are called as delta waves. And look at the PR interval. What happened to PR interval? See, it's around only 2 small boxes between PR. So it is short PR interval. Short PR interval and delta waves. And see what happened. There is discordant ST and T wave changes. That is, if delta wave is positive, ST T wave changes are negative. This is called as discordant ST T wave changes. See, there is discordant ST T wave changes. These combined together, these findings are seen in WPW syndrome. Once you diagnose this as WPW syndrome, you have to locate the bypass tract. Where is bypass tract? For that, you have to see lead 1. In lead 1, delta wave is predominantly negative. Delta wave is negative, so it is seen in right-sided bypass tract. There is right-sided bypass tract. Bypass tract is on the right side. So after knowing that it is on the right side, you have to know whether it is on the right free ventricular wall, or right posterior septal, or right anterior septal. For that, you have to see axis. Here it is, axis is left axis deviation. That means it could be either posterior septal or free ventricular wall. For that, you have to see, to differentiate whether it is posterior septal or free ventricular wall, you have to see lead 2. In here, lead 2, here it is biphasic or predominantly upward. So it is seen in free ventricular wall. If it is predominantly negative, that is in 2, 3 AVF QRS complex, that is delta waves are negative, means it is posterior septal. But here it is in lead 2, it is biphasic or predominantly upward. So it is seen in free ventricular wall. So in this ECG shows WPW syndrome with bypass tract on right free ventricular wall. So this is the diagnosis of this ECG. Hope you got this information useful. If you like this video, please like, share and subscribe. Thank you.